There are 10 pitfalls that you will want to avoid if you're trying to lose weight after bariatric surgery, whether you're at a weight plateau or you've experienced weight regain. Number 1, forgetting that obesity is a chronic disease. And chronic diseases need lifelong lifestyle modification and management. The hard truth is that you will never be done choosing the appropriate diet, which is low carb, even with bariatric surgery. Number 2, you lack the willingness to change and adopt new habits. I get it, it's hard. But nothing changes if nothing changes, even with bariatric surgery. This means that if you do it your way, instead of following all of the guidelines strictly, then you can expect to lose roughly 40% of your excess weight, and that is it. This means that for every 100 pounds you are overweight, you will lose about 40 pounds doing it your way. And even worse is you will have a difficult time maintaining this because you will not have learned the roadmap to weight management. Then, when weight gain happens, and it will, you will lack the roadmap on what to do about it. Weight freedom comes from knowing exactly what to do anytime you want to lose weight. Number 3, failing to adjust your diet to a high protein, low carbohydrate approach. Keep in mind that for the first 3 or 4 months after your surgery, your results can be misleading. Because with such a big calorie reduction, weight loss will happen, even if you are not following the guidelines strictly. This can lead to a false belief that you can get away with a diet of everything in moderation. This is one of the biggest mistakes I see people make all the time. Everything in moderation is false. Because using this approach will cause you to stop losing weight. Usually somewhere between 4 to 6 months after surgery, when your metabolism has adjusted downward to meet what you're currently taking in. This will definitely lead you to feeling frustrated and let down at your end result. The absolute best approach is one where you learn the modifications and make the choices to keep your body in weight loss mode for however long you need to be losing. And again, throughout life, whenever you need to. Let's face it, life happens and we have a chronic disease. Number 4, mistakenly thinking that either skipping vitamins or just taking a over-the-counter one a day is fine. Bariatric surgery changes the way your body processes food and nutrients. Your body definitely absorbs vitamins differently in both sleeve gastrectomy and gastric bypass. Dr. Merima and Whitney own the Building Blocks vitamin line, which has been in operation for over 25 years and follows the recommendation from the bariatric surgery guidelines, which means they are in the right amount and in the right form for a bariatric patient. This will prevent deficiencies in the majority of bariatric patients. The best approach is making a decision and a commitment to take a quality bariatric line supplement. Because then they will be in the correct chemical structure to be broken down without high levels of stomach acid. And bariatric surgery, both procedures, cause a definite decrease in stomach acid. And because they are in the right amounts based on what dose prevents deficiencies in most bariatric patients. Having worked in bariatrics for the last 25 years, I'm telling you that major health issues can occur as a result of vitamin deficiencies, all which could have been prevented. Gaining weight is the least of the concerns, but still important. Like permanent neurological damage is devastating. Crippling fatigue from anemia, cardiovascular events, and neuropathy are serious health concerns. In addition to taking the proper vitamins for your unique body's needs, annual testing is strongly encouraged. Number 5, skipping out on your bariatric center's follow-up visits or not engaging with bariatric weight loss experts to coach you. Someone who can redirect you when something isn't working and keep you motivated and accountable in reaching your goals. There is no doubt that this is a major lifestyle adjustment and it does take a lot of support. No one understands like coaches who are also patients. Number 6, don't make the mistake of skipping out on implementing an exercise program. There are so many benefits to regular exercise, like boosting endorphins, our feel-good brain chemicals, improving our mood, improving our sleep, and building muscle. See, one of the issues with long-term weight maintenance or management is that it is universally true that with rapid and massive weight loss, some muscle loss is also going to occur. The problem here is that if you do not put in the effort to build this back up, you will have an end result of a lower metabolism, making it harder for you to maintain your weight on the same amount of calories. Number 7, believing and ascribing to the sugar-free everything culture. Studies are now demonstrating clearly the spike when we consume artificial sweeteners is nearly the same as regular sugar. And when blood glucose and insulin levels go up drastically after consuming artificial sugar substitutes such as sucralose, aspartame, and others. We know that blood sugar and insulin spikes are the opposite of what we want when we're trying to lose or maintain weight. Better choices are likely stevia, monk fruit, or erythritol. Ideally, no artificial sweeteners at all. Number 8. After about the first 3 months or so after surgery, grazing or having small snacks and meals all day long is not recommended. Initially, it might have been advised because early on, we needed to eat a little more frequently in order to meet our protein and calorie goals. But once your food volume has increased at around 3 to 6 months, 3 meals a day is really best. Because grazing on little bits all day long is totally defeating the purpose of the operation to get fuller, quicker on less food. Number 9, we can't forget about managing stress and sleep as part of our health journey. Having less than 7 to 8 hours of sleep per night or frequent elevations in stress levels will impact results. And it makes sense because most people reach to food both when they're tired or have low energy as well as when they're stressed. It's important to seek out other stress management techniques such as meditation, deep breathing, exercise, visualization, listening to music, or any other thing that you know is a stress reliever to you. Number 10, last but not least, so many people make this mistake of not asking for help when they're struggling. The bariatric surgery is a fantastic tool. It lessens hunger, lessens cravings, and helps you to lose significant amounts of weight. But it's stomach surgery, not brain surgery, and it is a big lifestyle change. And when you're doing it the right way, you're often the only person in your life making such a big change. It is super likely that you would benefit drastically from counseling, therapy, or coaching. And engaging with a strong, health-seeking, focused group of other bariatric patients and mentors to turn to for support and encouragement and cheerleading. This is why the Bariatric Success Method coaching program is so effective at helping people drop significant pounds. Because Dr. Merriman and I care deeply about helping you meet your goals, and because we are patients too. And in coaching, not only do you get our vast experience in managing weight gain, but you get the support of others in the group having success following the same roadmap to cheer you on. So do yourself a favor, go to thebariatricsuccessmethod.com and book a bariatric solution strategy call to learn more. Help us help you figure out what is the bridge from now to wow.